The other markers you can take a look at is your fasting glucose, your fasting insulin, and your hemoglobin A1C. If you're fasting glucose, by the way, is like the worst of the markers to take a look at. But even if you're fasting glucose, don't let them just run a fasting glucose. Ask them to run a fasting insulin as well. If you're fasting insulin, and some docs, I like C-peptide, I think it's a better marker, but it's a little bit more expensive, and it's easier to get an allopathic physician, I think, to run a fasting insulin. But if your fasting insulin is above 8 or 10, even if your fasting glucose is normal, you're already headed into glucose or insulin resistance. I don't even like the term insulin resistance because I think insulin gets a bad rap. Insulin's doing its job. It's glucose resistance, which is really going on. The other things you can look at is your GFR, your glomerular filtration rate. And that's an indication of how well your kidneys filter fluids. If you're healthy, you should be in the 100, 120 range for your GFR. If your GFR is under 100, then there's some dysfunction occurring at the renal system, your kidneys, and T3 drives renal function.